Hey everybody, it's Dr. Eric Balkowitzer back for another edition of Thyroid Thursday, and today is lab review number 14. Going through another case that's come into to me for help. And in this situation, this is a patient who's really symptomatic. They do not feel well. They have classic signs and symptoms of hypothyroidism. They've got labs that indicate that they've got elevated lipids, they've got glucose resistance, their GFR is down, they've got indications of fatty liver, their hormones aren't regulating well. This is a person who really just does not feel good. Now, she's been diagnosed with hypothyroidism. It's been 5-6 years since she's been diagnosed. She's been to allopathic physicians, she's been to functional and integrative practitioners, she's been on T4, she's been on T3, she's been on T4 and T3, she's been on Armour, NP-thyroid, she's tried it all. Nothing really makes her feel well. When she's getting enough of a dose that she feels a little bit like she's starting to feel a bit better, then she gets some other symptomatology and she just doesn't ever feel well on any of the medications. She's been up and down on the medication doses, she's tried different ones, but nothing's ultimately made her feel really well. So we ran a comprehensive panel. We saw the lipids were a problem, the blood sugar regulation's a problem. There's inflammation markers, GFR is off. I said these things already, but there's indications that she's got tissue hypothyroidism going on for sure. So why aren't the medications maybe giving her the full benefit, bringing her back to normalcy or optimizing her, as some people might say? Let's take a look at her thyroid panel. TSH is 9.81, so across the board, anybody's going to say this is a person with hypothyroidism. This is a gland that's really struggling to make thyroid hormone. Total T4 is 4.1. This is lab low. Her total T3 is 75. It's lab low. It's not quite lab low. Lab low would be 71 most labs, but really pretty low. Free T4 is 0.87. and free T3 is 2.52. Both of these values would be, this is the free T4 at 0.87, pretty close to lab low. Definitely outside what somebody might say is an optimal range. Free T3 is inside the lab reference range, but most people would say this is not in the optimal range. Thyroid antibodies are negative, and if we do that free T3 to free T4 ratio that I talk about all the time, this is high at 0.35. So what's going on with this person? Well, this is a person who's probably going to need, you would think, would need thyroid medication, and that might make her feel better. And it did temporarily, but it never seemed to be the right dose. So what's going on? We looked at these lab work, we look at the health history, we look at the rest of the panel. And when I see this 0.35 and I see what's going on here, this is a person who I said, hey, have you ever been checked for iodine deficiency? She said no. So we ran iodine panels on her, and this is a person who is iodine deficient. So taking thyroid medication replaces thyroid hormone, but it doesn't fix an iodine deficiency. So one of the reasons why she probably didn't feel well is because she had an iodine deficiency, and iodine does more than just support the thyroid gland. It supports a whole bunch of other functions, immune function, everything else. She also probably has some underlying cell stress mechanisms going on, maybe infections and viruses, because if iodine is deficient, you have decreased immune killing capacity. So this is a person who we're going to need to do some deep work, but finding out that she's iodine deficient is one of the first things that we're going to need to address and work on, because we got to get the iodine levels up. If we get the iodine levels up, now we've got more support to the thyroid gland. It can start to make more hormones. So now she can make more T4, she can make more T3. She has more iodine in the system to support the other tissues, to support the immune system. So she might feel a ton better, but we've got to get the iodine levels up. So we've got to do a couple things. We got to identify why she's iodine deficient. Is it not in her food? Is she not eating anything that's got iodine? Is she been told to stay away from iodine like it's bad? So we got to address that. 2, we got to check your gut. She's got reduced gut function, so we want to make sure that she's able to absorb that iodine in the GI tract appropriately. She's got other indications of micronutrient deficiencies, probably because she's been hypothyroid for an extended period of time, because there hasn't been enough iodine to support the tissues. So that's created some gut dysregulation. It's creating other problems with the breakdown of her food and then the absorption of micronutrients. And that's, if we can start addressing the gut, get more iodine in there, she may feel a ton better. But keep in mind, even though it's not talked about much, there's 2 primary drivers, let's say 3 primary drivers of hypothyroidism, glandular hypothyroidism. 1 is there's been destruction to the gland. It's been removed, it's been radiated. There's been damage to the gland because of maybe cancers or abnormal tissue developing, and somebody had to have it destroyed or removed. That's going to create hypothyroidism. 2 is iodine deficiency. So it doesn't have, I think it's maybe not as big of an issue, or thought to be as big of an issue in developed countries, but I think it's becoming more of an issue. At least I'm seeing it as a bigger issue than some people give it credit. And then the third issue is immune-driven damage, because if there's cell stress response going on, that upregulates the inflammatory cascade, you upregulate the inflammatory cascade, and there's bacteria, there's viruses, or things that are driving the immune inflammatory response. Part of that cell stress response is the downregulation of metabolism, and typically what we'll see is immune cells starting to not just create this inflammatory process, not just decreasing the metabolism in the peripheral cells and tissues by increasing deiodinase 3, decreasing the conversion of T4 to T3, but we see more immune-based damage at the gland to slow down that metabolism. So in this situation, the person, at least right now, we don't have any indications that she has thyroiditis going on. She could. These negative antibodies does not mean that she doesn't have some thyroiditis going on, but she may be Th1 dominant. She's not producing a lot of antibodies. And so how would we determine if she's got thyroiditis or not? I'm not really worried about it right now. My number one thing to worry about is getting more iodine into her system by getting her some iodine, supporting gut and absorption of nutrients, and then we'll start to see how this whole thyroid panel changes in time and see if we've got some more significant immune-driven damage, or if this whole process has just been caused by chronic iodine deficiency. So I'll do a follow-up down the line, and we can talk to you about what's happened with this patient over time. If you have any questions on this video, put your questions below wherever you watch the video. Hope this helps. Take care.